אז אחר צהריים טובים לכולם. אנחנו נמצאים פה היום בוובינר של Sofwave ביחד עם דוקטור דיוויד גולדברג. יש אפשרות במהלך השיחה לשאול שאלות בצ'אט, שאלות יגיעו אלינו גם בעברית וגם באנגלית. אנחנו נשמח לענות על שאלות, דוקטור גולדברג ישמח לענות על שאלות בסיום המצגת. And I will turn it now to Dr. Shimon Eckers, our chairman of the board, to kick off the webinar. שמעון?
תודה רבה ושלום לכולם, גם אחר צהריים טובים וגם בוקר טוב לאלה שנמצאים בארצות הברית. אז זה גם עונג וגם כבוד אמיתי לארח אצלנו את דוקטור דיוויד גולדברג. יחד איתו נמצאים לוס קפיורי, ה-CEO שלנו, ואסף קורנר, סמנכ"ל הכספים, ה-CFO שלנו, וגם אנוכי. דוקטור גולדברג ואני מכירים מעל 30 שנה. לו ייכנס יותר לעומק בפרטים של מי הוא דוקטור גולדברג, אבל הוא אחד החוקרים הידועים בתחום, מדען בתחום של לייזרים ומכשירי אנרגיה לדרמטולוגיה ובעיקר לרפואה אסתטית. יש לו להערכתי הרבה מעל 100 מאמרים שהוא פרסם והמון עבודות. למרות כל זה, זאת אחת הסיבות שחשבנו שהוא איש מתאים. דוקטור גולדברג גם מנהל קליניקה מאוד מצליחה, מכיר גם את הצד העסקי של מה שאנחנו עושים, כך שיש לו ראייה מאוד רחבה ומשמעותית בחברה כמו Sofwave, ואני בטוח שיהיה לנו וובינר מוצלח ומעניין. So I'll move directly to English. Lou will do the initial part of the presentation, and then we'll hand it over to Dr. Goldberg. And of course, as Asaf already pointed out, you are welcome to send us questions by chat, and Dr. Goldberg, and if you will need help, us will try and help him along the way. So welcome everybody. Lou, the floor is yours.
Hello. Thank you so much for joining us today. I'm very happy and very pleased to share with you some perspectives on Sofwave, give you an overview of where we see the state of the company at present time, and then introduce Dr. Goldberg. At present time, as well as when Shimon co-founded the company was always designed and planned to be the market leader. And I'm very happy to report that at present time, we're displaying all the attributes of a market leading company. The leadership team is highly experienced. We have a very strong track record in developing market leading companies across medical devices, particularly energy-based aesthetic devices. We've demonstrated to date that we have a very unique application. Our FDA clearances are very broad, and the data surrounding both the scientific and clinical proof sources is quite strong. Our technology is patented. We have over 20 patents in progress. We also feel very comfortable that our technology is very, very difficult to copy. And as we look at our initial market launch over the last 18 months, we're very, very happy and proud to report that the individuals that have adopted our technology earlier rank among some of the most notable, influential physicians and providers in the entire world. This investment we made in terms of establishing these relationships and deploying our initial user sites has allowed us to set the stage for strong technology acceptance, as well as influence buying decisions across the peers of these top key opinion leaders. Of particular note, to sustain the business and grow the business, we have an exceptionally high ROI treatment for the practice. It's of high value. We deliver the value proposition to both patients and providers, as well as we have a high profit margin for the company. We not only sell the capital device, but every time we use the device, we achieve high margin revenue. The device is very easy to learn, use and maintain. Our results are consistent, which again is another very important attribute, and we have proven safety and efficacy. We expect continued revenue growth and increase in procedure demand. To date, over the last 12 months, just looking at a 12-month year-over-year window, we've done over 50,000 procedures, and our pulse revenues continue to increase. We have a growing brand awareness with a growing follower base across all the social media channels. We expect these numbers to continue to grow as we look forward. We're developing a highly qualified and compensated sales force with complete direct coverage across the US as well as the other important global markets. And at present time, we're building the necessary talent, teamwork, execution, and customer support to continue to scale. So I'd like to talk about our special guest today, Dr. David Goldberg. Dr. Goldberg is internationally recognized for his expertise in the field of aesthetic lasers. His education is across both the medical field and legal field, with his MD degree from Yale University School of Medicine. He has a legal degree from Fordham Law School, and he's a board-certified dermatologist with over 35 years in clinical practice. David, as well, is the past president of the highly prestigious American Society for Laser Science and Medicine, and he's also the first recipient of the premier prize that this society awards, the Leon Goldman Award, for excellence in clinical research, patient care, and education related to medical lasers. As we look at his credibility as an educator, Dr. Goldberg has published over 160 peer-reviewed manuscripts and is author and editor of over 12 books on energy-based devices across various categories in the field, and is known to be an innovator and contributor at every level across the spectrum, both from the KOL level as well as new fellows and people who follow this field very, very closely. He's been recognized as one of the best physicians in the United States. First accolade is he's been recognized by Self Magazine as one of the top 10 laser surgeons in the US, one of the best doctors in America by both Woodward and White, as well as Best Doctors Inc. And most recently, as just 14 days ago, Dr. Goldberg has been recognized by Newsweek magazine by a vote of his peers as the third best dermatologist in the US. Major lifetime achievement. As we look towards the clinical research end of Dr. Goldberg's extensive CV, he's the individual that led some of the clinical FDA investigation for Solta, which is the product is known as Samaj, and he's widely recognized across every company in this field as an expert for both his clinical research, his opinion on technology, how it works, where it should be applied, from companies, major market leaders such as Candela, MERS in the form of the Ulthera product, as well as InMode with his work on the Morpheus 8 and Fractoria. It is one of the great honors I have to consider Dr. Goldberg a good friend over the last several decades, as well as knowing a man of such high esteem amongst his colleagues. And I will turn it over to Dr. Goldberg to share his words of wisdom with those on the call. Dr. Goldberg.
תודה רבה, בוקר טוב, shalom לכולם. אני מדבר קצת עברית, and for everybody's sake, I'll give this talk in English. And so with that, I think Asaf is going to help me move along these slides. Just want to make a comment. I've known Shimon for over 30 years. I've known Lou almost as long as that through multiple different companies, and it's just a pleasure to be working with them again. So what are we talking about here? We're talking about aging skin. And all of us have it. There's no question about it. In Israel, Ashkenazic Jews probably don't belong in that desert. And I grew up in Phoenix, Arizona, and probably shouldn't have been there either. Because what happens is we get a 60% reduction in the collagen of our skin. That's the structure of our skin by age 60. And then the elastin, which is what gives us the elasticity, the give of our skin, the healthy look of our skin. In our 20s, we stop producing elastin at all. I would move all of you to the side so I can see all my slides here. So with older skin, as this elastin and collagen decreases, we start seeing sagging skin with loss of volume, wrinkles around our midface and the mouth, and then excess fat under the chin and neck. It's just not a good look, but we can't escape it. So next slide, Asaf. So what do we have to do to lift the skin, to tighten the skin, to reduce wrinkles? This is a somewhat complicated slide, but the point of it is we need to break down the old collagen and create new collagen. And you do that by getting temperature changes in that old collagen somewhere between 54 and 80 degrees. That allows us complete collagen denaturization with tissue coagulation and ultimately healthy younger fibers which tighten the skin and make the skin look healthier. Next slide. So this thermal injury, it's a heat-induced injury in the dermis, that's the second layer of skin, induces this new generation of new collagen and new elastin, the two things that decrease as time goes on. So we need outside energy penetrating into the skin, which creates these isolated heat injury zones in that second layer of skin, the dermis. That leads in all of us to an inflammatory wound healing response. The body sees that injury, creates new collagen, and it stimulates the growth of new collagen and elastin. And what that leads to is long-term tissue remodeling, which leads to skin tightening, wrinkle reduction, and lifting of the sagging skin. And as I said, the optimal treatment parameters require heating of those injury zones somewhere in that range of 60 to 70 degrees centigrade, and really to a depth of 1 to 2 millimeters. We can talk about injuring deeper and deeper layers, but they don't produce what we need. The depth has to be 1 to 2 millimeters in depth. And so optimal treatment also requires no epidermal damage. That's the outer layer of skin. We don't want to harm the outer layer. We don't want to create blistering. And we want to be able to use technology in all colors of skin. Because damage to the epidermis, that outer layer of skin, may result in long downtime to patients, risk of adverse events, including pigmentation problems and scarring, none of which we see with Sofwave. Next slide. So this is different. Again, I've spent my life dealing with thermage, dealing with therapy, dealing with fractional radiofrequency devices such as Morpheus 8, Fractora, and the others. This is very different. The superb synchronous parallel ultrasound beams, that's what that stands for, is a completely non-invasive 7 synchronous high-frequency ultrasound beams. Nothing else has this. And what you get is multiple unique geometric, 3-dimensional, cylindrically shaped thermal injury zones, which give us volume and directional thermal heating and coagulation, all parallel to the surface. So you're going the depth you need, you're not over-injuring the skin, yet you're covering large areas of the skin. And these unique vector lines of tightening along the direction of facial wrinkles are also in parallel to the natural vectors of skin tightening. And because we're at the right depth, there's virtually no damage to anything beneath that. We never worry about damage to nerves, bones, blood vessels, and as we saw with older technologies, sometimes facial fat, unseen and unheard of with the superb Sofwave technology. Next slide, Asaf. So, smart science for younger looking skin. You heard Shimon and Lou's introduction. Really is a breakthrough non-invasive synchronous ultrasound parallel beam technology. That's why it's called superb. And it answers what we need in our clinics. And that's a growing demand, which never seems to stop. Before you all got on the call, I said, we're so busy, I'm exhausted sometimes. We get this growing demand for treatments that deliver noticeable wrinkle reduction and a lifting to the eyebrows, neck, and the submental area. The multiple ultrasound beams deliver energy simultaneously. That coagulates more tissue than we've been able to do with other technologies. As I said, we want that depth of somewhere between 1 and 2 millimeters. And patients get a beneficial effect with that minimal penetration in a simple technology, very easy for our providers to learn to use the technology in a 30 to 45 minute treatment time for patients. That's all. Next. So, smart science, younger looking skin, treatment depth center, I've said, is 1.5 millimeters. It's independent of the energy level, it targets the effect in the mid-dermis, and ensures no damage. And I think when I treat patients, I think as a doctor, but I also think as an attorney. We see way too many lawsuits in the United States. We don't want damage to the underlying structures, bones, facial nerve, facial fat, blood vessels. We just don't see that with this technology. Uniform effect in the tissue, the parallel delivery of ultrasound beams and a large contact area allow for the low sensitivity to tissue homogeneity, ensuring repeatable and controllable energy deposition in the skin. It is also a solid state energizer module, 7 robust and stable ultrasound transducers, no moving parts, no optics, getting to that depth of 1.5 millimeters. Next slide.
Dr. Goldberg, I need to interrupt for 1 minute.
Sure.
חברים, לכל מי ששאל, במידה ואתם לא רואים את המצגת במסך הגדול, תחליפו, ללחוץ בצד ימין על המצגת, על הכפתור הימני, והמצגת תופיע לכם במרכז, ודוקטור גולדברג יהיה קטן יותר. Please continue.
Thank
Okay.
you. Just a technical comments to the viewers.
That's okay. Yeah, I understand part of it. So it's good. So it's a direct contract ultrasound technology that enables this integrated cooling system and real-time skin temperature monitoring mechanism that gives us that protection for the outer layer and yet allows us to accurately target the heat effect where we want it. And as I said, we treat virtually all skin types. I'm in the New York metropolitan area. It's a melting pot of the world. The ultrasound absorption is determined by the microscopic and bulk mechanical properties of tissue and is independent of any skin pigmentation or color. Next. So the FDA clearance, that's the term that's used in the United States, for Sofwave is to reduce facial lines and wrinkles, lift the eyebrow, lift lax skin of the neck tissue, lift lax skin of the submental beneath the chin tissue. And frankly, what we tend to do on many of our patients is treat their entire face because there's a global benefit. It is true that we reduce facial lines and wrinkles, that we lift the eyebrow, that we lift lax skin of the neck and beneath the chin. But overall, that skin looks healthier. Next slide. So what does a patient want and what do we need? I run a very large practice. I'm the director of cosmetic dermatology in the New York area for the Schweiger Dermatology Group. It's 110 offices, clinics between New York, New Jersey, Pennsylvania, and Connecticut. We need something that is simple for patients and simple for the practice. So it's a quick single treatment. You can treat pretty much every age and any skin type and consistently effective results, which historically we don't always get. Certainly in our large practice with 350 providers, we look for a high ROI. We want a quick ROI payback. It's got to be delegable and easy to maintain, use, and learn. Our practice is half physicians and half nurses and half physician assistants. I need to be able to teach them and feel comfortable that they're using this technology safely. And we want effective treatments and we don't want compliance issues, all of which we see with this technology, with Sofwave, both for the patient and for the practice. Next slide, Asaf. So let's get to the 300-pound gorilla in the room. Superb versus what I used before Sofwave, and that's high-intensity focused ultrasound. In the United States, certainly it's Ultherapy, which is the leading HIFU manufacturer. There are others in the world. HIFU has a coagulation pattern, which is totally different than that we see with Superb, with Sofwave. It has pinpoint 1 by 1 millimeter columns that are actually produced perpendicular to the skin. The ultrasound beams are emitted sequentially, and one of the big kickers that has really made us frustrated with the HIFU technology is these multiple different separate transducers, 1.5, 3, 4.5 millimeters. You have to change them, you're constantly replacing them, and you're often going to a depth they don't need to go to. And because you're going to such a deep depth with HIFU, with Ultherapy, you have to have real-time ultrasound visualization. We have a monitor where we have to use ultrasound to make sure we're not going too deep. Remember I talked about the fact that we don't want to affect the fat, we don't want to affect the nerves, the blood vessels, and so you need this real-time ultrasound visualization because of the depth of these. Contrast that to parallel ultrasound-based technology Sofwave, Superb. There you have these elongated cylinders. They go to a 1.5 millimeters in depth and 4 millimeters wide. They're parallel, not perpendicular to the skin surface, yet they're centered at the depth we need, 1.5 millimeter. And because of these elongated cylinders, parallel to the skin surface, a high volume is covered as we treat patients. So 28% of the skin is covered in 2 passes, 43% in 3 passes. It goes fairly quickly. And because we're at the depth that is not going to lead to injury to anything, that we don't want to injure. Obviously, we want to injure the collagen, but we don't want to impact on the fat or anything else. We do not need that real-time ultrasound visualization, which with all therapy, I have to train our providers to use. Don't need that at all with Sofwave, with superb technology. Next slide. So let's go through the FDA trials for wrinkle reduction. This goes back to already 2018, 4 years ago. Fine line of wrinkles, multi-center study. My good friends, Roy Geronimus and Ariel Kavar, 60 patients, single treatment, 3-month follow-up. And if you look at the improvement, it really was terrific. 86% had a reduction of at least 1 point in the Fitzpatrick wrinkle elastosis score. That's what we look at in all these skin tightening trials. And then more importantly, I would argue, for blinded evaluation, 78% were improved. Well tolerated, pain controlled easily with topical anesthesia, something not so easy to do with HIFU, with all therapy. Sometimes we have to give them much more than just topical anesthesia. As I said, safe for all skin types and so important to training new providers a favorable safety profile. Next slide. And then, we've got eyebrows and lax submental and neck lift pivotal trial that followed that, finished in 2021. Again, a multi-center study, included numerous other investigators, 80 patients, double treatment, 3-month follow-up. The eyebrow lift, if you look at that, 80% had eyebrow lift according to what's known as the Physician's Global Assessment Scale. That's physician's grading. 79% had eyebrow lift according to the blinded reviewers that were not treating. There certainly was a significant change in the objective measurements of the eyebrow lift. So that's the eyebrow. And then if you look at the neck and the area below the chin, 84.5% lax submental and neck lift, according to that same physician's global assessment scale. And then according to the blinded reviewers evaluation, 80% were improved, and then significant changes in objective measurements. Next slide. So here's one of our patients, and this is really, I think, the key take-home point. This is someone that we treated, and now we're a little bit over a year with her. It's not just that she has the lift and the tightening. Her eyebrows are lifted, her jowls are lifted, her cheeks are lifted. The overall quality of her skin looks healthier. She looks less tired. She looks like she came back from vacation. And that's all because of Sofwave's ability to create new collagen and elastin, which, yes, does tighten and lift skin, but it makes that skin look so much healthier. Next slide. And so these are some of the patients in the trials. This is Roy Geronimus patient, baseline and at 12 weeks follow-up. And you can see again that the neck, the improvement in the neck and the lifting of the jowls. Next slide. Here's another submental area. You see a month after treatment. Look what happens to those lines. Of course, they're still there. We're not going to turn someone into a 10-year-old, but look at the improvement in the quality of those necklines. Next slide. And then the eyebrow lift, just the healthier looking, more wide awake look. Look at the upper eyelids before treatment and then 3 months afterwards. And you can see the amount of skin now that's exposed after treatment just because of the lift of the eyebrows. He looks more awake. He doesn't look angry. Next slide. And again, 4-month follow-up here. This is Guillermo Novelli. Just that overall healthier look because of the lift, but also because of the collagen and elastin production induced by Sofwave. Next slide. And the same idea, 4-month follow-up, you can see from the side. Look at her neck, look at the quality of her skin, and you can even tell her eyebrows are lifted somewhat. Next slide. Back to the neck. This is we call it in the United States a home run. This is just a great result. You see that tightening, just overall healthier. And just looking at her neck alone, 4 months after treatment, I think it's fair to say she looks easily 10 years younger. Next slide. And here you see again the eyebrows and the forehead, that lifting there. This is without any use of any neuromodulators like Botox. Obviously, sometimes we'll add Botox to this, but this is without that. Next slide. So that leads us to questions and answers. Asaf, I'm going to hand it back to you.
Thank you, Dr. Goldberg. Everybody, you can submit your questions on the chat box, either in English or in Hebrew. We already got a few questions. Dr. Goldberg, one of the first questions that came up is, you're in the metropolitan New York, New Jersey area. What is the price per treatment that you usually charge for a Sofwave treatment?
Well, there isn't one price, as you can imagine. We have new providers, whether they're new doctors or some of those nurses or physician assistants I talked about. They'll charge $1,500 plus or minus for a treatment. And then the more established providers like myself, anywhere up to $5,500 per treatment.
5,500?
5,500. Don't be too shocked.
All right, thank you. Next question is, from your experience coming out of the Corona global pandemic, how do you see the market overall, and how do you see your clinic from your personal experience? How does the state of the market is post-Corona?
So, as you know, Asaf, I have offices both in New York City and in New Jersey. In March of 2020, we all thought the world was going to come to an end again. We had numerous of these events in the last 30 years. Our New York City office actually shut down totally for a year. New Jersey stayed open as a skeleton. From March of 2020 till July of 2020, we really did mostly medical dermatology. Reopened back up for cosmetic procedures in July of 2020, both in New York and New Jersey. By the fall of 2020, we were busy. And I have to tell you, with all the pandemic and all the Corona in New York and New Jersey that still exists, we are so busy, it's mind-boggling. And so, the pandemic still exists, but we don't see it in the office at all.
Okay. Another question that came in is, in the before and after treatment, the before and after pictures, after how many treatments the result was achieved. I can answer this. All this before and after were after one treatment. So this is the result after one treatment with the follow-up that we showed on the slide.
Right. Every slide I showed was one treatment, including my own.
Including your own?
Yes.
All right, great. Can you compare and talk a little bit about Sofwave comparing to InMode technology, both in terms of ease of use, patient experience, et cetera,
So I think the device that we're using, have used the most in the last 2 years of InMode is the Morpheus 8. But it's totally different. It is, first of all, it's radio frequency. It's not ultrasound, so it's never going to have the safety of ultrasound. But also it's piercing needles. That is microneedling radio frequency technology. And so even if it gave the same degree of tightening as Sofwave, which it actually does not, there's downtime. You're piercing the skin. There's going to be some bleeding. There is swelling. There is redness. People get through it, but there is that. The beauty of Sofwave is the ability to treat people and they leave the office and none of the family members know they've done anything. So we've had wives who have told us not to tell their husbands, and we've had husbands who've told us not to tell their wives when they had Sofwave. And it's easy because you can't tell they've done anything. If you do the Morpheus 8, they leave pretty beaten up. So very, very different technology.
Another question that came up is your view overall of the market in a case of a recession. I know everybody is talking about a potential recession. Everybody is hoping we are not heading there, but potentially we are in the US and globally. From your vast experience in the industry, how do you view the market going through a potential recession in the next few years?
Yeah, and obviously everybody's expressing that concern. You can't compare a recession to the beginning of the pandemic. When I think about the dips that we've taken in the practice, pandemic, a few months, 9/11, also a few months. But the real big dip we had was the last recession, which was 2008. And I can already see some differences. So in 2008, when we had that last global recession, it almost felt like the pandemic. We were so busy and it just dropped overnight. We just weren't doing anything. And it took a while to get out of that. But having said that, if you look at aesthetic dermatology during the recession, it's not that we actually did less procedures. We did about the same. We just didn't grow the way we had previously. So worst case scenario for Sofwave and technologies like Sofwave, we're going to be flat for a little while. Maybe we won't grow as quickly as we did before, but we're still going to be there. But having said that, you know, with the U.S. stock market dropping, you know, into bear territory, 20% down, you know, which exactly is what happened in 2008. In 2008, that led to nobody showing up in the office. We are so busy now, despite all that. So this is a very different time. And, you know, I don't want to say we're totally immune from the recession. This is not going to be like 2008. That I can tell just based on what's happening already in the office.
Interesting. Thank you. Another question that just came in. 1 second, we just got another question about recession, which you just addressed. What do you anticipate in terms of patient returning to the Sofwave treatment? Do you anticipate them to come every year, every 18 months? What's your perspective on returning customers?
Yeah, well, I tell them, you know, the facts, and that is, can't stop aging. There's no way of doing that, and you can't stop the effects of gravity. And so we've been telling them, and again, we have patients now a little bit over a year, to expect to come back around 2 years for a retreatment. And, you know, these are people who have done Botox every 3-4 months, who do fillers once a year. Telling them they have to come in for Sofwave once every 2 years or so is really not an issue.
Okay, great. We still have time for more questions. I know that we got quite a few, but if you have any additional questions, we're still happy to take them. I know that there was a question about wood therapy. You already touched a little bit about it in terms of user experience. Maybe you can elaborate a little bit more from your personal experience rather than the science perspective of us versus wood therapy.
So I think, you know, just going back to therapy, just to make it very clear, you know, I've used therapy now for, certainly over 15 years, if not longer, and have done studies and published papers on it. So, you know, it was the end all be all for ultrasound-based technology 15 years ago. You know, it just isn't all that popular anymore. And in part, frankly, because of Sofwave, the simplicity of Sofwave. But when we think about switching over, and I believe we have about 30 therapy devices in the Schweiger world that I'm part of. As we're switching over devices now and looking for more practical, easier to train, simpler technology, it's an easy switch. So, you know, I can assure you there will not be another therapy device bought within the Schweiger dermatology world. And as Lou knows, I mean, we already have several and we're looking to buy more.
Thank you. 1 second, I'm getting a few questions in different channels here, not only in the chat. Another question that came in is in terms of the doctors buying the systems, do you see any opportunity or potential for doctors to buy the devices online, or just visiting conferences or demoing the unit? How do you usually see the
I think there are a lot of ways of buying the technology. You know, in the end, as I said before, I think like a physician and an attorney, and I think training is appropriate. So even if it's however it's bought, there still has to be some training. My point is the training with Sofwave is simple. You know, I don't have, Morpheus, you brought up Morpheus, you know, from InMode. So when that was installed, we had training and there was training for providers, and then they no sooner left, and providers were starting to reach out to me with questions, complicated. Do I do this? How do I do that? What do I do with this? Sofwave, they come in, they train, and we don't need them back anymore. It's just that simple.
Thank you. It looks like there are repetitive questions about your perspective on recession. I know that you addressed it already, but there is a request maybe to get a few more comments with you about how do you see a potential recession.
Yeah. Well, I'm not an economist, so I'm not going to give you any guarantees. And even the economists with their guarantees, they're worthless. So all I can do is look at what's happening in our offices and compare it to what was so vivid to me in 2008 and 2009. It's very different. I see not just that the volume of patients is the same, it's actually higher than it was a year ago at this time, but I see the mood of the patients. You know, in 2008, everybody thought that the world was coming to an end. I think this time around, people have been through this. Remember the patient population that we're treating with Sofwave? You know, for the most part, they're 40 to 65. They've been down this road before with a recession. They know they'll get through it. They know it'll end. You know, we don't know how numerous world events will play out, but they ultimately do play out. And I don't see that degree of tension, forlorn, sad view that we saw in 2008. Now, in part, it's because we've just gotten through the pandemic and people realize, you know, thank God, we're moving on. And I think that has helped as well, actually.
Thank you. In terms of the treatment itself, do you, an MD, need to be around during the treatment, or it can be 100% delegated to someone else in the practice?
Yeah, you know, those rules vary from country to country and even the United States from state to state. But by and large, ultrasound technology, which Sofwave is throughout the United States, can be done by non-physicians. So yes, I treat occasional patients who want to pay my fees, but for the most part, we have them seen by non-physician, physician assistants or nurses.
Great. All right. Just gonna give a few more seconds for additional questions.
So Asaf, one more comment about the recession and why the numbers are not decreasing. You know, you have to remember, we came out of this pandemic, and in part doing what we're doing now, with Zoom calls and team calls and people getting to see themselves over and over again and really getting disgusted with how they look. I have to tell you that has helped us in the office. It's getting people to come in and seek, you know, every aspect of aesthetic dermatology. So this recession, to me, it's clear it's going to be different.
That's a great point. We've been talking about the Zoom boom and people watching and looking into their own face all day, sitting in front of the computer, especially when you compare our treatment to other microneedling technologies where you can actually not jump on a Zoom call immediately after the treatment.
Well, we've had people do that. We've actually had people who've asked me if they could stay on their Zoom call while they're being treated. We tell them not to, but technically they could, so yes.
Interesting. All right. I think we got quite a few questions here and we addressed them all. A few questions are repeating themselves, but we did talk pretty thoroughly about recession and comparing to microneedling. Just give me a second here on another channel. All right, I think that's it for now. I would like to thank everybody. Shimon, do you want to say a few words?
Sure. I mean,
בעברית, גם באנגלית.
Okay, from now on, only בעברית.
We'll do both, actually. So first of all, Dr. Goldberg, as usual, I mean, you tell the story much better than anyone else. And I believe to a large extent it is because of your unique, broad, and deep perspective, being in this and seeing the evolution of these technologies over more than 30 years. And I really want to thank you for that. I mean, I'll be frank with you, even I learned a few new things listening to you. So
hard to believe.
And I'll move and of course, thank you, Dr. Goldberg. It's always a pleasure to communicate with you and to listen to you. ואני אעבור לעברית, so תודה רבה לכולם שהייתם איתנו. כמו שאמרתי באנגלית, דוקטור גולדברג הוא באמת דמות ייחודית בעולמות האלה. כמובן, אנחנו עובדים איתו הרבה מאוד שנים, ועברנו איתו הרבה מאוד טכנולוגיות. לא בכולם היה קל, כמו שבמקרה של Sofwave. אני אגיד בכנות שהאתגר הכי גדול שלנו עם דוקטור גולדברג היה בימים של IPL. כי מה לעשות, זה לא היה קל כמו זה. This one I'm going to translate. I just told our listeners that we have lots of experience with you with various technologies that we developed over the years. It has never been as easy as it was with what we are doing today at Sofwave. Our IPL days were much more complicated in terms of being able to differentiate ourselves from what others were doing. So I think it's an important point to keep in mind. And again, back to Hebrew, אז תודה רבה לכולם, וכמובן אנחנו פה אם יש לכם איזה שהם שאלות או בקשות, ותודה רבה ללו, תודה רבה לאסף,
רק עוד הערה, שמעון, רק עוד הערה אחת ברשותך, בשביל לציין, אם יש משקיעים שרוצים שיחות גם one on one עם דוקטור גולדברג או עם רופאים אחרים, יש לנו באמת מגוון רחב של KOLs מכל התחומים פה בארצות הברית, מכל ההתמחויות, ונשמח גם לעזור בקשרים ובשיחות של אחד על אחד עם רופאים נוספים, או עם דוקטור גולדברג עצמו כמובן. Just said that we are welcoming investors to have one-on-one calls with various KOLs that we have working with us, including with you, Dr. Goldberg.
תודה רבה.
אז תודה רבה לכולם.